الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Demography for Health by Professor Mahmoud Hani Sulaiman. Lecture subjects: the demographic cycle, demographic trends in Egypt, fertility, family planning. Demography is the study of human populations. It is concerned with size, distribution, structure, change, and development of a given population. Size, distribution, structure, change, and development of a given population. Also, genetic inheritance, intelligence, and health. Role of demography in public health administration. For effective planning, designing, evaluation, and execution of health and healthcare needs for a community at present and the future. Knowledge about population with respect to size, structure, change, developments is essential. The following are number of applications of demography in health-related fields. First, mortality. Second, distribution, percent distribution. It is important for planning in health program. Third, determining success or failure of health programs. Describe level of community health. Determine causes of mortality and morbidity. Determine relative importance of disease with respect to age and sex to discover solution to health problems. Demography, study of population, their size, composition, and distribution. It equals anatomy and physiology in internal medicine. There are 5 processes which control size, composition, and distribution of population. 5 processes: fertility, mortality, marriage, migration, and social mobility. Fertility, mortality, marriage, migration, and social mobility. Demographic data can be collected from census, national sample survey, registrations of birth, death, and marriage, ad hoc demographic studies. Census, national sample survey, registration, ad hoc demographic studies. Uses of census. It provides demographic, social, and economic data, tell us composition of population, tell us mid-year population, which is important to calculate morbidity, mortality, and fertility rates, assess trend of population, formulate population policies and control programs, help to plan health and welfare measures like school, college, hospitals, and industries, help to compare with that other countries, help to formulate social security measures as life insurance, help to know quality of life of people. Limitations of census: infants generally under-enumerated, many persons do not know their exact age, old persons tend to add years to their actual age, information about handicapped persons is incomplete, information about work status is distorted. 2 fundamental indicators: crude birth rate, and crude death rate. Crude birth rate is number of live births per 1,000 people in estimated mid-year population in a given year. It is given by the formula number of live births during the year divided by estimated mid-year population multiplied by 1,000. By the same method, crude death rate is calculated. Demographic cycle. It is a series of phase transitions that most of the nations go through. From high stationary to early expanding to late expanding to low stationary, then decline. So the phases are high stationary, early expanding, late expanding, low, stationary, and decline. This graph shows stages of demographic cycle, beginning with high stationary stage, early expanding, late expanding, low stationary stage, and stage of decline. This table shows the population trend in the world. According to the year, the number of population in billions, annual growth rate, and the doubling rate. It increased steadily. The annual growth rate, as you see, is increasing steadily. Then here in 1987 decreased, and again in 2000 decreased. However, at first the doubling was at 130 years, then every 45 years, then in 40 years. And this is the annual growth rate of the world. The growth rate, annual growth rate, is crude birth rate minus crude death rate plus immigration rate minus immigration rate multiplied by 100. The doubling type of a population is about equals 70 divided by growth rate. 70 divided by growth rate. If a country has slow growth rate, less than 0.5, moderate growth rate, rapid growth rate, and very rapid growth rate. Among the world in 2090, the estimated annual growth rate was 1.1%. The growth rate is on decline in recent times, although population is still growing in actual numbers. Demographic trends in Egypt. Population of Egypt increased by 33.5% in past 25 years, reaching 84 millions in 2015. With annual growth rate of 2.6%, population expected to double in next 27 years. It is estimated that 57% of population lives in rural settings during 2012. About 20% of population is between ages of 15 to 24 years, and life expectancy at birth is 71 years. The literacy rate for youth is 98.3%. All adults 73.9%. Adult females 75.8%. Demographic trends in Egypt continue. The burden of disease attributable to communicable disease is about 11, non-communicable disease 84.7%, injuries 4.6%. The share of out-of-pocket expenditure share on health is 58%, and health workforce density is 2.8 physicians per 10,000 population, 3.5 nurses and midwives per 10,000 population. This is the Egyptian population pyramid at 2010 and projected for 2050. It is projected that increase of aged people, as you see. This is the total fertility rate in Egypt. You see it is decreasing, and need for family planning it increases, then have a plateau. This means that decreased number of children per family and family planning health services are satisfied. This is the dependency ratio. Among child dependency, it is decreasing. This is due to decreased number of children, and among old age is increasing due to increased number of older people. This is the general government expenditure on health as percent of general government expenditure. As you see, it is not changing much. Increased little, very little. Out-of-pocket expenditure as percent of total health expenditure. As you see, it increased. Out-of-pocket expenditure increased. This means that the need of people to cover their health needs increased and the government decreased. DPT-3 pentavalent coverage among children under 1 year of age as a percent. As you see, it is almost the same plateau. The coverage by measles of immunization, as you see, increased very little. Life expectancy at birth increased and projected to increase till 2050 in Egypt. This is a comparison of summary measures of population health in a developed country, UK, and a low mortality developing country, China, and a high mortality developing country, Afghanistan. I will not give remarks on Afghanistan because it has a very severe situation. Life expectancy in UK is higher. Infant mortality in China is higher. Probability of dying in China is higher. Probability of dying between ages 15 and 60 in China also higher. Health life expectancy in UK is higher. Proportion of years of potential life lost due to communicable disease in China is higher. Due to non-communicable disease in UK is higher. Injuries in China are higher. Maternal mortality per 100,000 in China is higher. Summary measures of population health. Two commonly used measures of a population's health are life expectancy at birth and infant mortality. Life expectancy and infant mortality, both used to compare population health nationally and internationally. Life expectancy at birth is average length of time that babies born today expected to live if today's age and sex-specific mortality rates applied throughout their lifetime. So it provides useful summary of current mortality rates. Babies born today are likely to live longer. Continued summary measures of population health. Health life expectancy, HLE, combines measures of morbidity with mortality to give average length of time that person in a specified population expected to live free of disease. It provides a better means of comparison for populations with high life expectancy, leading to low premature mortality from common disease as heart disease and cancer, but high levels of illness, leading to disease with low mortality as depression and musculoskeletal conditions. Disability adjusted life years, DALYs, provide a similar summary measure which includes years of potential life lost leading to premature mortality and years of productive life lost due to disability. Continued summary measures of population health. The fertility rate in a population is number of live births per 1,000 women of childbearing age, 15 to 44 years. Infant mortality is a key measure reflecting the health of population, especially health of pregnant women and care during childbirth to newborn babies and to infant. For details of infant mortality, look previous lectures. This world map shows the life expectancy of all the world. As you see, in Egypt it ranges from 71 to 75 years. Summary measures of population health: continued years of potential life lost. YPLL is an alternative method of summarizing mortality rate, which takes account of age at which death occurs. They are calculated as years of potential life lost before age 75 years, so that deaths occurring at younger ages, as from accidents, influence summary measure more than those occurring at older age. For example, death at 20 years from road traffic accident incurs 55-year PLL, compared to death at age 70 years from heart attack, which incurs 5 YPLL. Continued summary measures of population health: survival used in relation to a specified disease rather than as a measure of population health, and is therefore most useful in monitoring success of a treatment. It can be calculated in several ways: crude survival rate, corrected survival, relative survival. Crude survival rate, directly calculated, is number of people alive at end of a specified period of time, expressed as a proportion of those who were alive at the start of the period or from diagnosis. Corrected survival distinguishes between those dying from the specific disease of interest and those dying of other causes. Relative survival compares survival of a particular population group to group of general population of similar age, sex, and other characters. Continued summary measures of population health: attributable fraction, those exposed, attributable fraction, population. Attributable fraction exposed is the proportion of disease in an exposed population that would be eliminated by removing a specific causal exposure. So it equals risk in the exposed minus risk in the unexposed divided by risk in the exposed. Attributable fraction, population, is the proportion of disease in general population that is associated with a risk factor. It therefore takes the prevalence of the risk factor into account. So it equals risk in the population minus risk in the unexposed divided by risk in population. These two measures are used to calculate burden of disease attributable to a specific risk factors in a population. They are also referred to as attributable risk and population attributable risk. Attributable risk and population attributable risk. These two measures are very important in different kinds of research. We will mention some demographic data for Egypt. Total population at 2016, 95 millions. Gross national income per capita is $10. $10. Life expectancy at birth, male-female ratio, 68 for males, 73 for females. Probability of dying between 15 and 60 years, male-female. Among male it is 205, and among females it is 121. Other demographic data about Egypt: under 5 mortality per 1,000. As you see, from 1991 to 2015, it decreased from less than 90 to about less than 40. Maternal mortality ratio per 100,000 live births. As you see, it decreased at 1991 from more than 100, about 110, to less than 50 at 2015. وفي النهاية أقول الحمد لله و thank you for your good listening.